If your dog is having heat stroke, do this in the first 60 seconds. Vet emergency warning. Your dog has been panting after a hot walk, but this time the sound does not begin to slow. Saliva hangs from the mouth. The legs look unsteady. Your dog stops responding normally, and suddenly you are trying to decide whether to grab the car keys, search for a thermometer, offer water, or call someone. Do not spend that first minute waiting for certainty. Stop the activity. Move your dog out of the heat. Begin cooling with appropriate water and moving air. Call an emergency veterinary service and prepare to transport your dog while cooling is already underway. Heat stroke is a medical emergency, but the most useful first response is not a complicated home treatment. It is starting the right actions in the right order and understanding why cooling and reaching the clinic are two jobs that must move forward together. Share this safety sequence with anyone who walks, watches, or travels with your dog, because they may be the person who needs to remember it. A hot walk can turn serious before it looks dramatic. Your dog may still be standing, but the panting no longer slows when you stop. Saliva hangs from the mouth. The steps become shorter, less steady, or oddly reluctant. That change matters more than whether the day feels hot enough to you. Ordinary panting should begin to settle once exercise stops and the dog reaches a cooler place. Panting that stays frantic, especially with heavy drooling, weakness, vomiting, confusion, or poor coordination, can signal a heat emergency. Do not spend the first minute debating whether the label is officially heat stroke. Treat the pattern as urgent. Stop the activity. Get out of the heat, begin cooling, and contact an emergency veterinary service. The purpose is not to diagnose your dog beside the trail or in the yard. It is to prevent more heat exposure while professional help is being arranged. That first decision can feel surprisingly difficult because owners often expect one unmistakable sign. They imagine a dog collapsing when the earlier warning may be a familiar behavior that no longer looks normal. Compare your dog with their usual recovery. Are they becoming calmer after stopping or more distressed? Can they focus on you? Are they walking normally? Does their breathing begin to ease in a cool area, or does it remain forceful and relentless? A sudden decline after exercise, time in a warm car, or time in a poorly ventilated room deserves immediate attention. Heat stroke can develop during strenuous activity as well as passive heat exposure, and humidity can make cooling harder. That is why context matters. A dog does not need to be locked in a vehicle for overheating to become dangerous, and a route that was comfortable last week may be too much today. Once you recognize that pattern, keep the response simple. Stop movement. Move the dog into shade, air conditioning, or the coolest safe place available. Start wetting the body with cool or tepid water and create airflow with a fan, breeze, or car air conditioning. At the same time, call the nearest emergency veterinary service and follow its instructions. If another person is present, one person can cool while the other calls and prepares transportation. If you are alone, use speakerphone and begin the call without stopping the basic cooling steps. Veterinary sources differ on the best water temperature and when immersion is appropriate for different dogs, so do not improvise an extreme method. Cool water plus moving air is a broadly supported starting point while the clinic guides you. The important shift is that cooling and calling begin together rather than one waiting for the other. Do not let the search for perfect equipment steal that first minute. You do not need a special cooling vest, a digital thermometer, or a fully stocked first aid kit before you act. A hose, shower, bottle of water, sink sprayer, or another safe water source may help you begin. A thermometer can provide useful information if it is immediately available and you know how to use it safely, but checking a number should never delay cooling or the veterinary call. The visible trend matters. Worsening weakness, abnormal responsiveness, repeated vomiting, collapse, or seizure activity means the situation is severe. Keep the dog's airway clear and avoid forcing a weak dog to stand or walk. If the dog cannot move safely, use help or a stable surface to transfer them, while keeping unnecessary handling to a minimum and maintaining airflow. Water is helpful only when it is used safely. If the dog is alert, swallowing normally, and interested in drinking, small voluntary sips may be offered. Do not pour water into the mouth or force a distressed, confused, or poorly responsive dog to drink. That can create another problem when the dog is already struggling. Avoid reaching for human medicines, sports drinks, rubbing alcohol, or improvised mixtures. This is an overheating emergency, not a situation for experimenting with household treatments. The goal of first aid is limited but important. Reduce continued heat gain, begin controlled cooling, and get veterinary care moving. Even a dog that seems brighter after several minutes may still need examination because heat injury can affect the body in ways an owner cannot see from the outside. Improvement is encouraging, but it is not a reliable all-clear signal. Some dogs deserve an even lower threshold for concern. Flat-faced dogs may have less efficient air movement when breathing is already difficult. Older dogs, overweight dogs, dogs with thick coats, and dogs with heart, lung, or airway problems may also struggle sooner. Still, risk categories are not permission to relax with everyone else. Young, athletic dogs can overheat during intense play, running, hiking, or work, especially when excitement keeps them moving past the point where they would normally stop. Watch the dog in front of you, not only the weather app or the breed label. A key clue is loss of normal function. The dog cannot settle, cannot coordinate movement, cannot respond as usual, or suddenly refuses to continue. Those changes tell you that this is no longer simply a hot dog needing a longer rest. The instinct to put the dog in the car immediately is understandable. The clinic has the equipment, so every second on the road feels productive. The problem is that a warm vehicle, even with the trip already underway, may allow the dog to remain dangerously hot unless cooling has started and the cabin is ready. Turn on the air conditioning before loading when possible. Begin wetting and airflow first. Call the clinic, then transport as directed, continuing safe cooling during the journey when another person can assist. This is the 2-clock idea. One clock measures how long the dog remains overheated, while the other measures how quickly veterinary care is reached. The best response advances both clocks at once. It does not spend 10 minutes perfecting home care, and it does not spend the whole drive postponing the first cooling action. You may still feel guilty while doing all of this, especially if the outing seemed ordinary when it began. That emotion is understandable, but it is not useful in the emergency. Conditions change. Dogs become excited. Humidity, poor airflow, illness, age, and exertion can alter what they tolerate. Your job in that moment is not to explain how it happened. It is to notice that recovery is not occurring normally and respond. Remember the order. Stop the heat exposure. Move to a cooler place. Wet with appropriate water. Add airflow. Call the emergency veterinarian and prepare safe transport. Keep observing breathing, awareness, and movement, and report any worsening signs. The first minute is not about doing everything. It is about starting the right things without delay. So cooling begins while the path to veterinary treatment is already opening. That order becomes easier to remember when you picture the first minute as a sequence of overlapping actions, not a checklist completed one item at a time. In the opening seconds, stop the walk, game, or training session and move the dog toward shade, ventilation, or air conditioning. Do not ask an unsteady dog to keep walking to a more convenient spot if help can be brought closer. Loosen anything that may restrict comfortable breathing, keep the neck in a natural position, and begin wetting the coat. For thick or double-coated dogs, the water needs to reach the skin rather than sitting only on the outer fur. Add moving air immediately. A fan, breeze, or cool car ventilation helps evaporation carry heat away. While that is happening, call the emergency clinic. The sequence is not stop, wait, call, wait, then cool. It is stop, cool, call, and prepare transport together. The phone call should be short and useful. Tell the clinic what happened, how long the dog was exercising or exposed to heat, and whether the dog is alert, able to stand, vomiting, having diarrhea, or breathing with obvious distress. Say what cooling you have already started and ask where they want you to go. If the clinic gives instructions that differ from general advice, follow the clinician helping with your dog's condition. Put the call on speaker if you are alone. If another person is present, one person can keep water and air moving while the other prepares the vehicle en route. This division of jobs matters because panic often creates wasted movement, searching cupboards, gathering unnecessary supplies, or calling several people before veterinary help. The best first minute is rarely neat. It is simply organized around the actions that reduce heat exposure and shorten the path to treatment. Cooling method is where owners often hear conflicting rules, and pretending there is one universal sentence would be misleading. The Royal Veterinary College supports rapid cooling with water that is cooler than the dog and notes that cold water immersion can be appropriate for some young, healthy, conscious dogs. Other veterinary guidance commonly describes wetting with cool water and using strong airflow, especially during transport. Age, consciousness, underlying disease, breathing difficulty, and access to safe immersion can change the decision. That is why the most reliable public instruction is to begin water and airflow cooling immediately, call the emergency veterinarian, and use the method they recommend for that dog. Do not delay, because the available water is not a perfect temperature. At the same time, do not turn the emergency into an experiment with ice baths, alcohol, or aggressive improvised treatments. Fast cooling matters, but controlled guidance matters too. Imagine two versions of the same driveway. In the first, the owner lifts the dog into a hot car, drives with the windows barely open, and plans to start cooling at the clinic. The travel clock is moving, but the overheating clock is still running against the dog. In the second, the air conditioning is started, the dog is wetted, a veterinary call is underway, and cooling continues as the car leaves. Both owners are trying to reach help, but only one is advancing both clocks. This comparison is not meant to make anyone feel guilty. In an emergency, people naturally grab the keys because movement feels like action. The better response is to make the journey part of first aid. Cool the cabin before loading when possible. Position the dog where airflow can reach the wet coat and have another person monitor breathing and awareness without obstructing the driver. The dog's condition determines how much handling is safe. A conscious dog that can stand may cooperate with moving into shade or stepping into a suitable cooling area. A confused, collapsed, or poorly coordinated dog should not be pulled along by the collar or repeatedly encouraged to walk. Keep the airway clear, minimize stress, and use another person or a stable surface to help transfer the dog when available. Do not cover the body with a thick, wet towel and leave it there. A towel can warm against the dog and reduce evaporation. If a cloth is used to apply water or protect a surface, remove it rather than wrapping the dog. Continue wetting the coat and skin while air moves across the body. The practical test is simple. Your cooling method should allow heat to leave, not trap a warm, wet layer around the dog. Drinking water requires the same calm judgment. An alert dog that is swallowing normally may be offered small amounts and allowed to choose whether to drink. A dog that is confused, severely weak, vomiting repeatedly, or unable to control the head should never have water poured into the mouth. Forcing fluids can create choking or aspiration risk and waste time that should be spent cooling and traveling to the clinic. Do not substitute sports drinks, homemade electrolyte mixtures, salt water, or human medication. These additions do not solve the emergency and may create new problems. The dog needs veterinary assessment because heat injury can affect circulation, the brain, kidneys, digestive system, and blood clotting even when the visible panting begins to improve. A brighter expression or a few steadier steps are encouraging signs, but they are not permission to cancel the trip or stop following the emergency clinic's advice. Owners sometimes focus on finding an exact temperature because a number feels more certain than behavior. A thermometer can be useful when it is immediately available, the dog can be handled safely, and its use does not delay care. It is not the entry ticket for beginning first aid. If the dog has escalating panting, weakness, vomiting, abnormal responsiveness, poor coordination, collapse, or seizure activity after heat exposure, start cooling and call for help. Exact stopping temperatures for active cooling vary among protocols and should not be invented for a memorable video line. Overcooling is possible, so continue to update the clinic and follow its stopping instructions. The larger lesson is that a number supports the decision. It does not replace the decision. Waiting to confirm a perfect threshold can turn uncertainty into delay, while the dog's changing breathing, awareness, and movement already provide urgent information. By the time the vehicle is moving, the first-minute sequence should feel less like a medical procedure and more like a coordinated rescue. Remove heat, apply water, create airflow, call, and transport. Keep the car cool, avoid crowding the dog, and watch for worsening breathing, reduced awareness, vomiting, collapse, or seizure activity. Tell the clinic immediately if the condition changes during the journey. Do not stop for special products, and do not assume that a dog who seems calmer is now safe to take home. The outward signs may improve before internal complications become clear. This is where the two clocks meet. Cooling buys the body a better chance, while veterinary care addresses the damage first aid cannot see or treat. Once that distinction is understood, the next problem becomes easier to spot: the well-intentioned choices that look helpful but can slow cooling, trap heat, or create a dangerous delay. The first well-intentioned mistake is treating every cooling rule as universal. You may hear never use cold water in one place and immerse the dog immediately in another. Current guidance is not identical because the safest method can depend on the dog's age, health, consciousness, breathing, and the setting. The Royal Veterinary College supports cold water immersion for some young, healthy, conscious dogs, while recommending water plus airflow for older or medically vulnerable dogs. Other veterinary sources commonly advise cool rather than very cold water. In a real emergency, do not lose precious time arguing with the tap. Use water that is cooler than the dog, add strong airflow, call the emergency clinic, and follow its instructions for your dog. The dangerous choice is not failing to find a perfect temperature. It is delaying all cooling while searching for certainty. A second mistake is wrapping the dog in a soaked towel and leaving it in place. The towel may feel reassuringly cold when it first touches the coat, but it can warm quickly and reduce the evaporation that helps carry heat away. If a towel is used to apply water, protect the car, or help transfer the dog, it should not become a heavy blanket around the body. Keep water reaching the coat and skin, and keep air moving across the wet surface. The same principle applies to thick fur. A light mist sitting on top may do far less than thoroughly wetting through the coat. Watch the dog rather than admiring the setup. If breathing, awareness, or coordination is getting worse, the response must keep moving toward veterinary care. Cooling equipment is useful only when it helps heat leave the body without creating delay or trapping warmth. Another common reaction is trying to make the dog drink as much as possible. An alert dog that is swallowing normally can be offered small amounts of plain water, but the choice should remain voluntary. Do not pour water into the mouth of a confused, collapsed, vomiting, or poorly responsive dog. Do not reach for sports drinks, salt mixtures, rubbing alcohol, fever medicine, or other human products. None of those replaces controlled cooling and emergency treatment, and some can create additional danger. The same rule protects you from internet remedies that promise to shock the system or rapidly reset body temperature. Heat stroke is not fixed by one household ingredient. First aid has a narrower purpose: reduce further heat exposure, start safe cooling, preserve breathing, and shorten the time to professional treatment. Simple actions are not less effective because they look ordinary. In an emergency, simplicity prevents mistakes. A thermometer can also become a distraction. A rectal temperature may help the veterinary team if it can be checked quickly and safely, but it is not required before you begin cooling. Clinical signs such as relentless panting, weakness, poor coordination, vomiting, confusion, collapse, or seizures already justify urgent action after heat exposure. The other trap is chasing a number for too long once cooling has started. Different protocols use different stopping points, and excessive cooling can become harmful. Rather than inventing a memorable temperature from a social media post, update the emergency clinic and follow its directions. If measuring the dog requires wrestling, delays departure, or puts someone at risk of being bitten, skip it. The thermometer is a supporting tool, not the leader of the response. Your priorities remain the dog's breathing and awareness, continued safe cooling, and rapid transport to veterinary care. Perhaps the most dangerous mistake comes when the dog appears better. The panting slows, the eyes look brighter, the dog manages to stand, and the trip to the clinic suddenly feels unnecessary. Do not let visible improvement become an automatic cancellation. Heat stroke can affect circulation, the brain, kidneys, digestive tract, liver, and the body's ability to clot blood. Some complications are not obvious beside the road, and a dog may need examination, laboratory testing, fluids, oxygen, medication, or close monitoring even after cooling has improved the outward signs. Tell the clinic about every change, including improvement, and let the veterinary team help decide the next step. First aid and veterinary care are not competing options. Cooling addresses the dangerous temperature, while the clinic looks for consequences that water and airflow cannot diagnose. Feeling relieved is reasonable. Treating relief as proof of recovery is not. At the hospital, the team may check temperature, heart rate, breathing, blood pressure, hydration, mental responsiveness, glucose, electrolytes, kidney and liver values, and clotting function. The exact tests and treatment will depend on the dog's condition, medical history, and response to cooling. Some dogs may need intravenous fluids, oxygen, medication for complications, or continued monitoring. This is why a clear phone report and a quick timeline can help. Tell the team when the heat exposure began, what activity the dog was doing, when the behavior changed, whether vomiting or diarrhea occurred, and how cooling was performed. Do not feel embarrassed if the timeline is imperfect. Emergencies are messy. The useful details are the ones that help the team understand exposure, symptoms, and response. Your job is not to arrive with a diagnosis. It is to arrive with the dog and the best information you can provide. Prevention begins by noticing that heat risk is not limited to parked cars. Strenuous exercise, high humidity, poor ventilation, direct sun, hot enclosed rooms, and excitement that keeps a dog moving can all contribute. A familiar walk can become harder when the weather changes, and athletic dogs may continue working or playing before they show an obvious problem. Check temperature and humidity, choose cooler hours, shorten the route, carry enough water for drinking and cooling, and build in genuine rest breaks. Watch recovery, not just enthusiasm. A dog that wants to chase the ball again may still be struggling to release heat. Dogs with flat faces, thick coats, excess weight, older age, or heart, lung, and airway conditions need more conservative plans. Prevention is not about keeping a dog indoors forever. It is about adjusting the activity before the dog is forced to stop. Before the next warm day, make the emergency response easier for everyone who cares for your dog. Save the nearest emergency clinic's number and address. Keep water, a bowl, and a simple way to wet the coat in the car or walking kit. Know who will drive, who can call, and how you will move a weak dog without forcing it to walk. Most importantly, remember the 2 clocks. Begin cooling while veterinary help is being arranged. Stop the activity. Move out of the heat. Use appropriate water and airflow. Call the clinic. Transport as directed and do not cancel simply because the dog looks better. You do not need to predict every dangerous moment or perform perfect medicine at the roadside. You need to recognize that normal recovery is not happening and begin the right sequence. That calm preparation can turn a frightening minute into purposeful action.